If you are 65 or older and enrolled in Medicare, there is something that could be quietly costing you money every single month without you even realizing it. Many seniors assume that once Medicare adds a penalty to their premium, the charge is permanent, correct, and unavoidable. But that is not always true. Every year, thousands of people pay Medicare penalties they may not actually owe, simply because they do not understand how the rules work, they miss an exception, or they never realize they have the right to challenge the charge. The problem is that Medicare penalties can continue month after month and year after year. Even a small additional charge can add up to hundreds or even thousands of dollars over the course of retirement. For someone living on Social Security, a pension, savings, or a fixed income, that money matters. Today, we are going to look at the Medicare Part B and Part D late enrollment penalties, how they are calculated, who is required to pay them, who may qualify for exceptions, and what steps you can take if you believe Medicare made a mistake. Many people are surprised to learn that some penalties are based on information Medicare may not have received properly. Others discover that their employer coverage should have protected them from a penalty, but was never documented correctly. And some retirees learn years later that they had appeal options they never knew existed. This is why understanding these rules is so important. Let's start with Medicare Part B. Part B covers outpatient medical services, doctor visits, preventive care, lab work, and many other healthcare services. Most people become eligible for Medicare at age 65. When you first become eligible, Medicare gives you an initial enrollment period. This is your first opportunity to enroll in Part B. If you do not sign up during that period and you do not qualify for a special exception, Medicare may assess a late enrollment penalty. Many seniors hear about this penalty but never understand how it actually works. The Part B penalty is generally equal to 10% of the standard Part B premium for every full 12-month period that you could have had Part B but did not enroll. What makes this important is that the penalty is usually not temporary. For many people, it lasts as long as they have Medicare Part B. That means a decision made years ago can affect premiums for decades. For example, imagine someone delayed enrollment for 2 full years without qualifying for an exception. That person could face a 20% penalty added to the standard Part B premium. If the standard premium changes in future years, the dollar amount of the penalty may change as well, because it is tied to the premium calculation. This is where many people become frustrated. They assume the penalty must be correct, because Medicare is charging it. But Medicare's determination is only as accurate as the information available during enrollment. And that leads to one of the biggest misunderstandings involving employer coverage. Many people continue working after age 65. Others remain covered through a spouse's employer health plan. In these situations, Medicare often allows individuals to delay Part B enrollment without facing a penalty. However, specific rules apply. The coverage usually must come from active employment. This distinction matters. Many seniors mistakenly believe any health coverage after age 65 automatically protects them from penalties. That is not always the case. Coverage from a former employer, retiree coverage, COBRA in many situations, or certain other plans may not provide the same protection. This is where costly mistakes often occur. Someone may believe they are safely delaying Medicare enrollment, only to discover later that Medicare considers the delay uncovered for penalty purposes. At the same time, the opposite can happen. A person may actually qualify for an employer coverage exception, but still receive a penalty because Medicare did not receive adequate documentation. This is more common than many people realize. Suppose you worked until age 68 and remained covered under a qualifying employer group health plan. Under Medicare rules, you may have been eligible for a special enrollment period when that employment ended. If the paperwork submitted during enrollment was incomplete, missing, or processed incorrectly, Medicare could determine that you enrolled late without qualifying coverage. The result may be a penalty that should never have been applied. That is why documentation is extremely important. Many seniors do not keep employment and health coverage records once they retire. Years later, when questions arise, locating the necessary proof becomes much more difficult. If you delayed Medicare because of employer coverage, it is important to maintain records showing the dates of employment and the dates your health coverage was active. Documents from employers, benefit administrators, payroll departments, and insurance providers can all become important if questions arise. Now let's talk about Medicare Part D. Part D helps cover prescription drugs. Like Part B, Part D also has a late enrollment penalty. And like Part B, many people do not fully understand how it works. The Part D penalty generally applies when someone goes without creditable prescription drug coverage for a certain period after becoming eligible. The key phrase here is creditable coverage. Creditable coverage means prescription drug coverage that Medicare considers at least as good as the standard Part D benefit. Many employer plans, union plans, and other drug plans meet this standard. But not all coverage does. This is where confusion often begins. A retiree may assume they have adequate prescription coverage and therefore delay Part D enrollment. Years later, they discover Medicare does not consider that coverage creditable. As a result, a penalty may be added to their monthly premium. The Part D penalty is calculated differently from the Part B penalty. Instead of a percentage of the Part D premium, Medicare uses a formula involving the national base beneficiary premium and the number of uncovered months. Because the formula can change over time, many people have difficulty understanding exactly how their penalty amount was determined. What matters most is that the penalty can continue for as long as you have Medicare drug coverage. Again, this means that even relatively small monthly charges can become expensive over the course of retirement. This is why keeping annual notices regarding creditable coverage is so important. Many employer plans send letters each year informing participants whether their prescription coverage is considered creditable under Medicare standards. Unfortunately, some people throw these notices away. Others never pay attention to them. Years later, when Medicare questions prior coverage, those notices can become valuable evidence. One of the most common situations involves retirees who switch insurance plans multiple times. Over the years, coverage records can become fragmented. Enrollment dates, termination dates, and prescription coverage details may be difficult to reconstruct. When Medicare reviews enrollment history, missing information can create problems. This is why maintaining a personal file containing insurance records can save significant trouble later. Now let's discuss another issue that many seniors overlook. Sometimes people assume that penalties are automatic and cannot be questioned. That assumption can be costly. If you believe a Medicare penalty was assessed incorrectly, there may be procedures available to request a review. The exact process depends on the circumstances. In many situations, Medicare or the plan administrator may request supporting documentation. This is where records become essential. You may need proof of employer coverage. You may need evidence showing active employment. You may need notices demonstrating creditable prescription drug coverage. You may need enrollment records showing that paperwork was submitted on time. Without documentation, correcting a mistake becomes more difficult. With documentation, you may have a stronger basis for requesting a correction. Many seniors never pursue a review because they assume the decision cannot be changed. Others simply do not know where to start. But if you are paying a penalty and something does not seem right, it may be worth examining the details carefully. Even long-standing penalties deserve a closer look if you have reason to believe an error occurred. Let's talk about some warning signs that should prompt further investigation. First, think back to when you turned 65. Were you still actively working? Was your spouse actively working? Were you covered under a qualifying employer health plan? If so, you may want to review whether Medicare properly recognized that coverage. Second, consider your prescription drug coverage history. Did you have employer-sponsored drug coverage, union coverage, or another plan that provided creditable coverage? Do you still have annual notices or records confirming that status? Those documents could be important. Third, review your Medicare premium notices. Many beneficiaries pay premiums through Social Security deductions and rarely examine the details. But reviewing notices can help you identify exactly what charges are being assessed. You should understand what portion represents your standard premium and what portion reflects a penalty. Many people are surprised when they discover they have been paying a penalty for years. Fourth, think about whether you ever received official explanations regarding the penalty. Did Medicare explain why it was imposed? Do you understand the enrollment period Medicare believes you missed? Do you understand how the calculation was performed? If the answer is no, obtaining clarification may be worthwhile. Understanding the reason behind a charge is the first step toward determining whether it is correct. Another important point involves timing. If you believe a penalty was assessed incorrectly, do not assume the issue will resolve itself. Delays can make record collection more difficult. Former employers may merge, close, or change record-keeping systems. Insurance companies may have limited access to older records. Benefit administrators may change. The sooner you gather documentation, the easier the process may be. Many retirees are surprised by how often paperwork becomes the deciding factor. Two people can have nearly identical situations. One has complete records and receives a favorable review. The other cannot document prior coverage and struggles to prove eligibility for an exception. Documentation matters. This is why proactive record-keeping is one of the most valuable habits retirees can develop. Keep enrollment confirmations. Keep employer coverage records. Keep creditable coverage notices. Keep correspondence from Medicare. Keep premium statements. You may never need them. But if questions arise years later, having those documents available can make a major difference. Now let's address another misunderstanding. Some seniors believe that because they delayed Medicare intentionally, they automatically deserve a penalty. That is not necessarily true. Intent is not always the issue. What matters is whether the delay occurred under circumstances that qualify for protection under Medicare rules. Someone may intentionally delay enrollment because they are covered by active employer insurance and fully comply with Medicare requirements. That person may qualify for a special enrollment period and avoid penalties entirely. The details matter. This is why it is dangerous to rely on assumptions. A penalty notice does not automatically mean the determination is correct. At the same time, it is important to be realistic. Not every penalty is a mistake. Some penalties are properly assessed under Medicare rules. The goal is not to assume Medicare is wrong. The goal is to verify that the information used to calculate the penalty is complete and accurate. Think of it as a financial review. If a charge affects your monthly healthcare costs for years, it deserves careful attention. Even modest corrections can result in meaningful savings over time. Let's look at a simple example. Suppose a retiree pays an extra amount every month because of a Medicare penalty. The monthly charge may not seem dramatic, but over 10 years, that amount could total hundreds or even thousands of dollars. For households managing fixed retirement income, every dollar matters. That is money that could be used for prescriptions, groceries, utilities, transportation, or savings. This is why reviewing your Medicare enrollment history can be worthwhile. Many seniors spend more time reviewing bank statements than Medicare records. Yet Medicare premiums directly affect monthly retirement income. Understanding those charges is part of protecting your finances. Another important step is reviewing correspondence from former employers. Many retirees have files stored away containing health plan information they have not examined in years. Within those files may be enrollment notices, coverage confirmations, or creditable coverage letters that could help explain past enrollment decisions. You may already possess the documentation you need without realizing it. The challenge is simply knowing what to look for. If you are uncertain whether your situation qualifies for an exception, gathering records is still a useful first step. The facts often become clearer once enrollment dates, employment periods, and coverage timelines are organized. Many people discover gaps or misunderstandings only after reviewing the timeline carefully. What seemed confusing at first becomes easier to understand once all the dates are laid out. The key message is simple. Do not assume a Medicare penalty is automatically correct. Do not assume a penalty is automatically wrong either. Verify the facts. Review your records. Understand why the charge exists. Determine whether employer coverage, active employment, creditable prescription coverage, or other qualifying circumstances may apply to your situation. Many seniors never take that second look. As a result, they may continue paying charges they never fully understood. A little investigation today could potentially save money for years to come. The most important things to remember are these. Medicare. Part B and Part D penalties can increase your healthcare costs significantly over time. Employer coverage exceptions may protect some individuals from Part B penalties. Creditable prescription drug coverage may protect some individuals from Part D penalties. Documentation is often the key to proving eligibility for exceptions. Employment records, enrollment records, coverage notices, and creditable coverage letters can all be important. If you believe a penalty was assessed incorrectly, reviewing the details and gathering supporting documents may help you determine whether a correction should be requested. Most importantly, understand exactly what Medicare is charging you and why. The better you understand your premiums, enrollment history, and coverage records, the better positioned you are to protect your retirement income and avoid unnecessary costs. Subscribe and share this with someone who may need this information.